everyone, and welcome back to Medigap Show. I'm your host, Holly Cohen. I'm a licensed independent broker and founder of MedigapCares.org. We're a nationwide Medicare coverage agency helping you understand Medicare and all of your options when it comes to Medicare Supplement Plans and also Medicare Advantage Plans. And go on our site, MedigapCares.org, to book a free consultation with either me or an experienced member of my team. And when I say of my team, it's either going to be me, my husband Steve, or my daughter Sarah. So we're a family-owned business licensed across the country, and we are here to help you. So today we have an in-depth journey ahead as we explore the world of Medicare. Specifically, we'll focus on Medigap Plan G and Plan N and how they differ from Medicare Advantage. So before we dive deep into the details, this video is designed to be your comprehensive guide. So get ready for the next few minutes to listen for essential Medicare information. But before we get started on this detailed comparison, make sure to hit that like button and subscribe to our channel. By doing so, you stay informed about crucial information that can help you make an informed decision regarding your Medicare coverage. Let's begin by clarifying something very important. Medigap plans, often called Medicare Supplement Plans, such as a Plan G or a Plan N. So it's crucial to understand with a Medigap plan, you remain firmly on original Medicare, giving you freedom to choose your healthcare providers, and you're not switched off of the government's Medicare red, white, and blue program, your Part A and Part B card. Now, let's move on to explain something about a different way to be on Medicare, Medicare Advantage. Medicare Advantage, or Part C, is an alternative to original Medicare. These plans are provided by insurance companies, and they come with networks such as a PPO or HMO network of healthcare providers. While Medicare Advantage plans can offer you extra benefits, they do come with restrictions. Number one, it does replace your original Medicare, and by doing so, it does put you into a network plan. So you do have to make sure your doctors and hospitals are in network. And there are many times prior authorizations for medical treatment when you're on a Medicare Advantage plan, which unfortunately can delay treatments for many Medicare beneficiaries on that program. Currently, 51% of our Medicare beneficiary population are on Medicare Advantage plans. It's crucial to understand that Medicare Advantage plans take you off of original Medicare. This is the fundamental difference between Medicare Advantage versus original Medicare with a Medigap plan. Important to know when you're trying to make this crucial decision this time of year. So now let's zero in on the differences between Medigap Plan G versus Medigap Plan N. Medigap Plan G offers comprehensive coverage. It pays for nearly all of the gaps in original Medicare, leaving you with very minimal out-of-pocket expenses and allowing you to have the peace of mind to know you're covered for almost all medical costs. A Plan G allows you to remain on original Medicare. It pays the 20% coinsurance after original Medicare Part A and Part B pay the first 80%. You on a plan, Medigap Plan G, you are only responsible for that Part B deductible, which this year in 2023 equals $226 for the year. It may go up slightly next year. They have not yet made Medicare has not yet made a formal announcement. As soon as they do, I will make sure that you hear it from me as well on the Medigap Show. Plan G, you enjoy peace of mind knowing that you're covered for almost all of your medical costs except for that $226 deductible of Part B of Medicare. Medigap Plan N is also a very comprehensive Medigap Plan. It is almost a twin to a Plan G. The difference being is that with a Plan N, you have lower monthly premiums, which is nice. You also may have some co-payments, including up to $20 for office visits at your doctor and possibly $50 copay at an emergency room if not admitted to the hospital. You also may incur what's called Part B excess charges. This is when a doctor or outpatient facility charges the patient more than what Medicare will pay them for that service, because Medicare, original Medicare, is a fee-for-service program. So when you're on a Plan N, you could incur what's called Part B excess charges, meaning you would be responsible for 15% of the difference between what Medicare pays the provider and what the provider bills to the patient. So for example, if you were going in for an MRI at a top-of-the-line, state-of-the-art MRI center, and that MRI center wants more than what Medicare will pay them for the service. So let's say that an MRI costs $1,000. That means that Medicare will pay the first 80%. They will pay $800. That would be their fee for an MRI service. Now, this particular MRI center, because they've invested so much money in their equipment, they want to charge more than what Medicare pays them for an MRI. So the difference from what they want to charge the patient, Medicare beneficiary, versus what Medicare is paying them for that service. If Medicare pays them $800, for example, because a typical MRI would cost $1,000, let's say this MRI center wants $2,000. That means the Part B excess charge equals $1,200, $1,200. That also means that if you're on a Plan N, you would incur 15% of that $1,200 amount. There's more interesting information about Plan N. There are a handful of states in the country that are not allowed by law, by their state law, to charge Part B excess charges. These states are listed here. These are called Medicare Overage Measure states. We call them MOM states. That's the acronym. So what that means is if you live in one of these states, you can have a Plan N and it would function almost exactly in your state as a Plan G. The only difference being it's less in monthly premium, usually $30 to $50 per month less, and you may possibly incur that up to $20 copay at your doctor's office and up to $50 copay at an ER if not admitted to the ER. So in the MOM states, a Plan N is almost like a Plan G. We write a lot of Plan N policies for the MOM states, but we do also write a lot of Plan N for Florida, because in Florida, the premiums are much higher than other states in the country. And then, of course, New York State, the premiums are higher, but New York is one of the MOM states. So it is illegal for a provider or outpatient facility, a Part B service, it's illegal for them to charge that Part B excess charge in those MOM states. So to sum up what an excess charge is when a doctor or outpatient provider can charge more than what Medicare approves for that service. Now, these fees are manageable compared to the out-of-pocket expenses of Medicare Advantage plans. So let me also go into a little more depth on the Part B excess charge. Many doctors find it very difficult to deal with the red tape that is involved to send to Medicare why and how, and they have to fill out lots of information on why they are charging more to a Medicare beneficiary than what Medicare is paying them for that service. So many times the doctors, even outside of those MOM states, the doctors in outpatient facilities typically will accept what Medicare pays them for the service. So which plan is right for you, Medigap Plan G or Medigap Plan N. It ultimately comes down to your healthcare needs. How often do you go to the doctor? And your comfort level for out-of-pocket costs, meaning those Part B excess charges are there. That gap is not closed on a Medigap Plan N for Part B excess charges, but it is closed on Medigap Plan G, meaning Medigap Plan G, you're only out of pocket for the entire year, is the Part B deductible. On a Plan N, you may incur a little more, and if you go to a doctor more than once every 3 months, rule of thumb is you may want to look at Plan G. Because if you're paying $20 every time you go to your doctor's office and you're saving by being on a Plan N, let's say $40 or $50 a month, your copays are going to add up, and it may not be worth it for you to pay the doctor's office the copays versus having a Plan G where your premium is slightly higher in cost, but you don't have those copays at the doctor's office. Both Medigap Plan G and Plan N keep you on Original Medicare, allowing you the freedom to choose your doctors, your hospitals throughout the whole country. At medigapcares.org, we are here to help navigate these choices with you. Feel free to schedule your free Medicare consultation with us or call us at 855-265-6334. We're happy to go over every detail of all the plans with you. When considering Medigap Plan G or Medigap Plan N, you are choosing to stay firmly on Original Medicare, ensuring that flexibility to choose your healthcare providers. Remember, these Medigap plans can be your safety net, protecting you from unexpected medical expenses while preserving your freedom of choice with your healthcare. When you're on Original Medicare, if your doctor deems something as medically necessary, you will get it without a prior authorization, and a Medigap Plan G or N will fill in the gaps and pay that 20% after Original Medicare pays the first 80%. At medigapcares.org, you are our priority. And don't forget to hit that like and subscribe button and share it with other friends and family members that can benefit from this Medicare information. I look forward to seeing you next time on Medigap Show, and as always, be well.